I don't remember the last time we were in here doing this. It's been a while, but hello, everybody. Welcome to Manhattan Community Board 4 Housing, Health and Human Services meeting. JD, thank you for listening to me. Hello, guys. Hello. So welcome to Housing, Health and Human Services Committee meeting for March. My name is Maria Ortiz.
Janine, you're on the screen. Put in gallery view, please. Yes.
You have to be able, you have to change it to gallery view from your end.
No problem. Got it. Thank you.
All right, Janine, sorry, you're beautiful. We have to do gallery. All right. But what? Janine is still?
Yeah, she's in
That's
gallery.
fine?
Yes.
All right. Dover Suches is my co-chair. I'm the other co-chair. We meet the first Thursday of every month. In-person attendance is required for all CD members. For all meetings, unless a member has an extraordinary circumstance and or disability. If a member does not have an extraordinary circumstance and or disability, they're considered absent and not able to vote. And if committee members are joining via Zoom, they must leave their cameras on. Tonight's meeting is being recorded and currently live streaming on YouTube. If you're here in person, and you do want to speak, write your name on the list. We encourage everyone to sign up to receive emails from MCB4 to receive the agenda and community information. If this is your first time, let's see, there's 5 attendees. If this is your first time attending a meeting, really quickly, I'll just share that each presenter speaks first, and the committee members ask questions and make comments. Next, members of the public can ask questions or make a comment. Finally, the discussion goes back to committee, and during the committee discussion on some agenda items, committee members may vote to write a resolution, and that resolution or letter goes to the next full board meeting and is voted on. The full board meetings are held the first Wednesday of every month. And if you're attending virtually and want to make a comment or ask a question after a presentation and after the committee has spoken, just raise your hand. It's on the bottom of the screen. And that is it. I think we can start with the self-introductions of the committee members, if you like, Jeff, starting with you.
George Dutra, co-chair, Housing and Human Services.
Hector Vasquez, committee member. Larry, committee member. Kitchen. John Daniel Nolan, member.
Good evening, Carlos Rousseau's Coordinator, Relations Coordinator, Alpha Angel Stephen.
Pete Diaz, a member of the board.
Of the committee.
William Arboleda, interim executive director, Ron Chelsea Clinton.
Roberta Barnett, member of the committee.
Paul Ames, public member of this committee.
And other guests.
Oh, today, Chelsea Penn. Alexa Cruz, New York tenant. New York City, Alvin tenant.
And we have,
Travis Rogers, public member.
all right, thank you.
On the line. Anyone say that?
Thank you. And on the line, who do we have? Betty and then Wilson.
Hi, Wilson Cano member.
Betty, you're up.
She's talking, she's on mute.
You're on mute.
Betty McIntosh, member of the committee.
Very good. Thank you, thank you, thank you. And I'll let Joe take this part
Yes.
here.
So first I want to apologize to everybody. I have an odd thing on my voice that's going in and out today for some sort of post-nasal thing, so all of a sudden squeaky. That doesn't sound very odd, but that's the thing. So tonight we have a presentation from Ryan Chelsea Clinton Community Health Center. They're applying for a specific grant. Will Arboleda, interim executive director, please give us your presentation.
Thank you, Joe.
And it was in the Dropbox too.
Well, members of the committee, public, thank you for giving me the time to speak.
Do you want that put up on the screen too?
Sure, if you like. Yeah.
Jenny, keep it on the screen.
Sorry, the presentation?
Yeah.
Yeah, okay.
So who's your last name again?
Arboleda.
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 Tree grove.
Yeah.
Go ahead.
Okay, so, again, thank you to the committee for allowing me to speak. Just want to go into a brief synopsis of the center and what we do. So in 1967, Ryan Health was established to meet the community needs for healthcare services on the Upper West Side. In 1977, we became an independent community-controlled health center. So we were the third community health center in the nation, behind the Rural Center in Mississippi and Fenway Health in Boston. And this is part of the war on poverty. We're named after William F. Ryan, who was a civil rights and healthcare activist, a congressman in the Upper West Side. Today, we're a network of health centers across Manhattan. We have 18 sites currently, providing access to a wide range of patients. So providing affordable quality healthcare services for over 50,000 patients. In 2001, Ryan Chelsea Clinton opened on 45th and between 45th and 46th and 10th Avenue. We are an independent affiliate of Ryan Health. And we meet the needs of the community.
Next slide.
Oh,
Yeah. Just say next slide.
yeah, the next slide. Oh, okay, that was, I'm sorry.
Yeah. Remember, the hybrid world is. where-
Yes, I should just look up here.
Yeah.
So we meet the needs of the community. We have currently over 13,000 registered patients. Last year, we had almost 52,000 unique patient visits. To put that in perspective, when we were opened in 2001, the space only, we only predicted, or the space only allowed for 5,000 visits. So we did 52,000 visits last year. And since 2019, we've grown over 20%, 25% in patients and 20% in visits. Next slide. So just our vision, we're committed to maintaining our role as a leader in the health center movement. Our team of dedicated individuals are responsive to the needs of the community, and we strive to enhance and improve the services, providing the highest quality of care, regardless of anyone's ability to pay. I'll talk about that in a second. And our mission is providing high quality, affordable, comprehensive, linguistically appropriate, and culturally competent healthcare services to medically underserved populations, treating everyone with dignity, respect, courtesy, confidentiality, and concern for safety. Next slide. So going back to what I was saying, regardless of the ability to pay, we accept Medicaid, managed care as well, plans, Medicare, and most private insurances. But that is not also a barrier to providing care. So if someone doesn't have any insurance, we still see them on a sliding fee scale, depending as low as $35 per visit. And if they can't afford that, whatever they can pay. And we also have a low-cost pharmacy. So going into the reason I'm here tonight, next slide. So due to our space constraints and the demand in the community for healthcare services, especially with the New Yorkers coming upon us the past year and a half, we have the opportunity to request funding from New York State to help us expand critical health services in the community. So we are seeking funding to support purchase and the outfitting of a fully equipped mobile medical van to better address the needs of homeless individuals, migrant asylum seekers, and also support the community partners throughout the neighborhood. Next slide. So this mobile medical unit will be basically a health center on wheels. It'll have 2 fully usable exam rooms. It'll have Wi-Fi access for electronic medical records. It'll have a consult room, a space to do administrative tasks. So some of the services are basically going to mimic what we have at the center. Primary care for adults, adolescents, pediatrics, HIV and HCV testing with linkage to care, COVID-19 and STI testing, providing vaccinations and immunizations. We have a medication restriction treatment program to help with opioid addiction. That'll serve that for outreach. We can do mental health, and in our plan, we also plan to have mental health services available. We can enroll individuals in insurance. We can screen for social determinants of health and also provide health education services. And everybody that comes into the van will also have access to our full range of services on the center with a warm handoff. So basically, if you're being seen on the van, you're registered as a patient and enrolled, and any service you get on the van, you can get at the center. Next slide. So the network, Ryan Health, already has a medical van, which we utilize from time to time. But again, because it's being used all over the city, we have limited access to it, which is why we're asking for the center, Ryan Chelsea Clinton, to have its own van. So these are just some of the organizations we've worked with. I continue to work with. Our last event we just did with PS 111, we helped immunize 60 children so that they could actually attend school.
It's great.
Yeah, because right now, because we're at capacity and we've seen almost 8,000 new New Yorkers since the middle of 2022. The wait to see a pediatrician right now for a new patient is over a month. Right? So because we have certain programs, we can help, and utilize the van will increase access, and we can go directly to the organizations, to the schools, we're working with a couple of other schools, PS 191, PS 51 also wants to help, needs help. And, we're looking to address those needs. But again, we're at the mercy of the networks van who is also out 4 or 5 days a week. So this is definitely an expansion of the services. We just met with someone from the DOHMH yesterday who's connecting us with shelters directly, because that has actually been a barrier, right? We would love to go and park in front of a shelter and provide direct services, but for many different reasons, which I won't get into, because it's a long conversation, has been difficult. So we're working on that. I think that's it. The last slide. This question. His question. Yes. So I will take those.
How much do you need and who do you need us to ask?
So actually,
And what is the exact New York State program?
so it's a practice transformation grant from the New York State. It's, there's, I believe part of it is DASNY, the Dormitory Authority, right? So actually, they're not looking for letters of support.
Okay.
What they are looking for is to say, proof that I came to the board and presented this to community, and the community knows that this is coming and knows that it is.
We can still give you a letter of support.
Yes, I don't think they'll take it, but yeah. But so the cost is gonna be probably in the range of $300,000 to $350,000.
For the vehicle fully equipped.
For the vehicle fully equipped, yeah.
Okay, now, William, I'm a big supporter of Brian's.
Yes, you are.
You guys are great for the community, great for the new Americans coming in. I do have a question, and I hope I don't offend people here, but I have a question about this medical van. I live on 48th Street. We have maybe 6 or 7 facilities in a 6 or 7 block area. I have come out in front of our little park and seen a van parked there, medical van. And I say, why is it there? Now, we need to help the homeless, the unhoused, we need to help everybody. However, if you have a van there, and people are going to be coming from somewhere else to use the van in front of a park, let's say where children are going to the park, it becomes a problem, because we have to protect the neighborhood as well. So where are these vans going to go? Am I going to walk out on 48th Street and see Project Renewal, a big van with a whole line of people on the sidewalk waiting to get in?
So are you asking about when it's not being utilized?
No, when it's being utilized, what is your means and methods?
So can I tag on that question? Because that's so much.
I'm asking, where's it gonna park?
Okay.
So I actually wanted to ask about where the parameters of the van is going to travel, and do they have different stops for like a 7-day period? So it's very similar to that question, like, is there a rotational plan? Obviously hit, you say you service Chelsea, Clinton, Midtown, it's not all parameters of our neighborhood, so I'm trying to figure out where this van will be.
So so working with the community-based organizations, we would go where they want us to go, right? So during the pandemic, we went to St. Bart's Church, working with Breaking Brown, we went to St. Bart's Church, Fifth Avenue Presbyterian Church, we've gone to Metro Baptist Church, we've gone to Fountain House, so we would be working together with the organizations for their clients and wherever they go.
So conceptually, the schedule where you be at one location,
Yeah.
X to Y one day, another day, yeah. So when you park, so 48.
But it's not a rotation, really.
It's not.
It's that request, it's a
It's
request.
that request, right? So we might be in front of Fountain House every Tuesday. Then we might be at Metro Baptist every Thursday, right? So is it you can call it a rotation, but and then we would go, like, if a school needed, so we'd be in front of a school.
So here's a question I have, if possible. Clearly, you're hearing from specific organizations who are saying this is a hot spot.
Yeah.
This may be where we need it. Would there be an opportunity to add a mechanism for communication around, basically, I'm sure you're not someone gonna call and say, show up tomorrow.
No.
You schedule and plan things. If perhaps there's a way that the communication is given to the community boards, block associations, and the organization itself uses its own network to at least let people know when it's scheduled for the week.
Oh, absolutely. So Carla,
Oh, yes, but I guess what I'm, and I want to support this, I
No.
want you to get your van, and it's a wonderful thing. I'm just, when a neighborhood becomes saturated, and there's gonna be a van, and there'll be people outside on the sidewalk.
I don't think that's the mistaken impression here. This is not about a van goes to a location to service a whole bunch of people from an area. This van goes to a location to serve the clients of Fountain House in front of Fountain House.
Mhm.
No one's waiting to get in, people are
Oh,
in Fountain
okay,
House.
so it'd be
That's what
like-
it's
it'd be
different.
like-
yeah, it's not an outreach plan. It's like, so.
It's not an outreach plan at all.
Laura, so
I knew that's what you were going with here.
Carla, no, yeah, it's not an outreach. You know, we have done that outreach where we would go to, you know, places where sexually risky behaviors are taking place down on Christopher Street, and we would go out there to do
Right.
targeted outreach. That's not our plan.
Okay.
You know, Carla is our community relations coordinator, right? So she manages our events calendar, right? So that's shared internally. We also have our website, and also Carla has a listserv where she sends out community events, right? So that calendar will be able to, and we can also send it directly to the community.
Yeah.
So my.
I know well in advance.
It said it's going to treat, you know, the unhoused, but
Right.
essentially you go in front of Fountain House.
I mean, that's just one example, yes. We can go to different
And
organizations.
they come in and it's really a traveling little clinic. So they
Exactly.
Come in and go.
And there's a
to the place.
schedule that happens, like I've seen it at Metro Baptist on certain days, right? Like on certain days, they have the toiletry pickup.
Right, but it's just for those folks that are in.
It's
that-
just for those, folks. if somebody's coming and they ask questions and we will
Right.
definitely
That's right.
discuss, we're not gonna turn them away, but like, yeah, it's, you know. A lot, I mean, one of our biggest barriers have been people coming to us. People are not gonna come to us.
Right.
Even though we're really busy, but you know, to get to the people that are hardest to reach, we have to get to them.
Gotcha.
Right, so this van will help us with our space constraints.
Yep.
But it will also help us in reaching, again, the most vulnerable in workers.
That's great.
Like, for example, Metro Baptist also houses a program called Damayan, which works with Filipino home care workers, right? So they extend services,
Right.
and then they could set a day where that particular population in that organization would know they can make appointments.
And these organizations have, you know, have achieved equity with these organizations, so they know if they're bringing us in, that they know that we already come in with a certain amount of name recognition.
I'm not sure if New York State will ask you more specifics on the funding, but I'm curious to know, I mean, $350,000 is an expensive asset.
Mhm.
What's the useful life of it? What are the monthly or annual maintenance costs? How are you going to fund the personnel that are, you know, gonna run it, manage it? Can you talk a little bit about that?
So, you know, once we get, you know, so the practice transformation grant is a capital fund, so it's
It's
basically.
a one-time.
It's a one-time thing, so we would be responsible, right, so we would also look for alternate fundings, private foundations, other state grants, you know.
Are you doing that now? Are you asking for that money now, or is that gonna come after?
I think that would come after, I think we've discussed how much it's gonna cost, the ancillary costs, the other than personnel costs, the supply costs. You know, the storage costs, right, because we gotta park the van, right, it's probably in the Bronx. You know, but also we use it indirectly as a retention tool for our providers, right? So, you know, one of the challenges we have is that, you know, to be competitive in the marketplace for medical providers, right? We have, you know, we're not gonna pay as much as hospitals do or bigger organizations, right? So a lot of our providers who are in community health for a reason, you know, they've shown an interest and they actually many times will come to the van. They want to come to the van once a week to get out of the center maybe, or to do this type of medicine. You know, so having a provider one day a week as a rotation will help us with space in the center. It creates 2 open exam rooms, right?
Right, opens your exam rooms there, but
Exactly, right? And then it's staff satisfaction, you know, staff retention. It's a tool that we use frankly for staff retention. So, you know, that cost is already baked in, but you know, we would look to private foundations and other grant funding to help support that.
So you, okay. Pete, this has a question.
Yeah, it's just, the van itself, it's gonna cost about 355.
About approximately is different, we're pricing it on a,
An environmentally friendly, electric, or is this gas pump? Or-
so this would probably be gas, maybe natural gas, but you know, electric, there's no funding for electric and it wouldn't be any cost benefits.
Wouldn't.
And probably, it would probably take a week to fully charge. I'm kidding.
I'm just wondering about that. Well, no, I mean, they're tax credits, if you got one. for-
Right, so for this particular grant, there are no tax credits, from what I was told, but. you
Because
know,
it's not a, it's not. a-
Right, yeah,
But also remember, there are not for profit, so the tax credit benefits.
yeah.
It is actually a little tricky.
I did ask that question about, could we look at an electric option?
Yeah, and just so you know, going forward, you are not able, as a not-for-profit, believe it or not, to sell your energy tax credits to the for-profit entity. There was a tweet that was made in November of 23, and I just happened to fall across it by accident. It's a very useful tool, so you can acquire things that have credits that you can use, and then they can be sold to somebody else.
Well, very interesting.
Additionally, I work for a nonprofit, there's a parking tax exemption that you can file for the vehicle.
Yes.
And also there's a parking pass exemption you can file for the vehicle too.
That,
So you don't have to park in the Bronx always.
it's not about parking in the Bryce, because we don't wanna leave it on the street, right? So we have to park it in a lot.
Where are we?
And alternate sides, you gotta make it across the street, you know.
Between, sorry.
I mean, I would love to park it in the bus layover lane, 40-60-10, but.
That was an investor.
Stay.
I know Betty's been.
Oh, sorry, Betty?
Betty?
For a while.
Hi, I'm all in favor of the van. It's terrific. I just have one or two questions. I want to know if anybody from any part of the city can have access to the van. That's,
Yes, absolutely, yeah, so, you know, I wanna focus on CB4 because the demand is great, and I'm sure we could fill 5 days a week just within our area. But yeah, we would go down to the Lower East Side, to Harlem, to Washington Heights, wherever, you know, wherever needed. You know,
that
but
isn't,
I think
that
we
isn't
have-
what
I
I
think we
was,
have a demand here that we don't need to go outside of these
Right.
zip codes.
that
Betty.
wasn't like the gist of what I was saying. I live right next to Church of Holy Apostles and is very familiar with Metro Baptist Church. There are people who come from other neighborhoods to those churches. So I just wondered, there's no limitation on where you, like if the van is at Church of Holy Apostles or at
No
Metro.
geographic eligibility.
No, we have patients, while 70% of our patients come from this neighborhood, we have patients coming from all over the city,
Oh, okay,
out of
okay,
state, you know.
okay,
We
and
have-
then
we have
I got it.
HIV patients who come from
Anybody.
Florida every 3 months because the care is
Okay,
better.
anybody, and then if
And the
some,
second question,
if somebody comes in to the van and they have something very serious that would require going to the emergency department of a hospital, how do you handle that?
so like we would do at the center, right? So a nurse, and there would be a nurse on the van, and, you know, and they would triage with a provider. Just like we did at the center, we would call 911, or if it was not as emergent, but they needed to go, we would send them in a Lyft or an Uber, which we do now at the center. So, you know, if the ambulance, if it's really emergent and they couldn't be transported on their own, we would call an ambulance, or we would just send them in a Lyft or an Uber, which is currently our workflow at the center.
Great.
Okay, thank you.
And then JD.
So I think my question kind of goes along the line of what Betty just asked. So it's about continuity in services. So for example, it said in one of your slides that you provide mental health counseling. That's something that's a long-term thing usually. So how does it work? Do you refer these patients that come to the van, you know, say, oh, you present for mental health counseling, do you refer them out? Like, how does that work?
So we have behavioral health integration, which is short-term care that works together with the PCP, with the primary care provider. And we also have mental health, and we have psychiatry at the center. So And while there is, we do have we have a partnership with Fountain House where we provide psychiatric services to their clients who are now our patients, right? But we also, part of that agreement, right, we also have dedicated 24 hours, about 20 to 24 hours of psychiatric services at the center for non-Fountain House patients, right? So it's usually a referral directly in-house, but if not, we also are able to refer out if we don't have this. There is a waiting list. Like,
Just for psychiatry though, it's different than psychology, right? Like psychologists,
you don't have psychologists.
so you don't have psychologists.
No, we have social workers, LCSWs, LMSWs, and then we also have
Oh,
psychiatrists.
but you do have social work.
Yes.
I have one.
Yeah, but I'm also guessing that, and that is totally dependent upon your space and your space needs. That if you had more space,
Yes.
you would be able to have a less of a weight. Ryan is a very odd program that has gotten so successful. It's outgrown the space that we all worked decades ago. It works. So they're not exam rooms and meeting rooms.
Okay. A little more fun. So another question I had was, so for the uninsured patients, you said you provide a sliding fee scale.
Yes.
Just was wondering if you require any like documentation, like what, if I'm an uninsured patient, I walk up to the van, what questions, if any, do I need to answer?
So they would ask your income. Again, we don't even, if we ask for ID, we ask for as much information, as much insurance, income information as possible. But it's not a barrier. It's really more for us. We have to report to the government, who, and put you in the sliding fee scale so we can charge you appropriately.
Okay, but.
And there will be no charge. We are not gonna charge anybody on the medical van.
And you would just take what I say?
Yes. Yeah, we would ask you, so if somebody comes in and they don't have their insurance, we would put them at the highest or the lowest fee scale and then ask them, put a note in the chart, say, please bring your income information. I think JD had
Yeah,
a.
JD then.
Just quick things, minor thing, but are there motors that run all the time?
That is, I think we're able to turn it off and then have a generator, internal generator. I'm not really sure the ins and outs of the machine, but it won't be idling.
Yeah, we're talking about idling and noise.
Yeah, no, it won't idle.
Most tenement buildings, they're not soundproof, so you hear everything rattles. Second question, the asylum seekers are new Americans. Will the van help them, say, if the Watson Hotel or some location? And if so, we need to.
I think they've had some issues with shelter, sorry.
Yeah.
What's happened?
Yeah, so we don't.
Kind of sense what I heard.
We
Kind of
don't
not
really
say.
have access to the shelters that much, like they know to call me directly, or they know to send their folks to the center, but. For us, for example, if somebody has an abnormal result and we need to do outreach to say, we might know where they live. But if we call the center, they won't, if we call that shelter, and it's for privacy reasons, which I understand, they won't patch me through, so I will have to say, this person needs to call me back. In a very vague way.
I think it'd be great if you could.
That is our goal, yes.
I think it's important to make contact with the local.
Yes.
Citizen advisory group or whatever first.
Community advisory.
There have been some issues on 7th Street, for instance.
Yeah, I just,
Better to avoid it.
we know that the shelters are now run by multiple agencies.
Yes.
As we have discussed.
I thought they were run by multiple agencies from the beginning.
No,
No, including.
health and hospitals never ran a shelter before.
Oh, okay, first one, like,
Yeah, HPD had minimal, now they have an HPD shelter, I don't know.
so they're not farming it out to CBOs.
Yes, they are, and they aren't.
Okay,
So we have we have, we have HHC, we have HPD, we have DHS directly, they can't find a provider.
Right.
So they're running shelters, they can't find a provider, and then, emergency, mayor's office of emergency, things like.
Emergency management.
I mean, emergency management, yeah, we're talking like people that have never run this stuff before. So it's a lot of different slices, and I can understand why, who knows who you can talk to about,
Good luck.
Yeah.
about what?
I said just good luck.
Yeah, good.
Yeah. Yes, so,
So, I'm having a little trouble understanding, this thing about the shelters. If I were a foundation, you're coming to me to.
can I say one thing, no, I'm gonna pause back. This is not, our subject here today is not about providing a van for shelters.
No, I
Understood.
I just wanna go too far.
Actually, it goes back to my funding question about how you're gonna ask for money for the monthly or annual maintenance of this very expensive piece of equipment for which you're not getting any money from the state. You're gonna have to come up with your own sources and justify something. If you're gonna go to a foundation, ask for money, and let's say this foundation is focused on helping immigrants, how are you gonna show your success, the impact that you're having on immigrants?
Well,
You can't take any information down, you can't share it with the shelters, how are you
Well,
gonna?
we can take demographic information and keep it anonymous, like we don't have to disclose private health information, but we could say, we are seeing X amount of women. In this year, X amount of folks who speak Spanish, with people of Latino descent, so we can give that demographic information, right? And we can also show that, we keep track of of how many folks we filter from the van into the center. How many people we help, because.
So that is the plan.
Yes, that is the
In
plan, right.
to do that.
And anybody that gets seen, right, and then we do outreach and they decide to have services in the van, they are enrolling as a registered patient. And they are included in our electronic medical record, which means now they are a registered patient.
You know, the stats and everything. flow.
Yes, exactly.
So just again, you'd be.
And then for the funders, again, we can back out any personal information and just have demographic information.
Okay.
Right, sex, ethnicity, all of that stuff, to satisfy the funders' requests.
Well, it's gonna be no different from any other funding that this clinic needs. They have to try to find funding for every part of the program, and so.
So that might be helpful, give a little bit of sense of scale, because some members may not understand who Ryan is. How many locations, what's your overall operating budget? You need to.
So we had an overall operating budget last year of $13 million, right? And, we broke even, so we were doing right, but a lot of that is dependent on our payer mix. Right, because we get certain reimbursements, right? We get a higher reimbursement from Medicaid and Medicare than we do from private insurance. And while we do accept folks who don't have any insurance, our rate of reimbursement is a lot lower. So our goal is to enroll folks who are not insured into Medicaid. That helps us fund programs, that helps us pay for, and again, we don't want to provide the service. And again, bottom line is we have to have money to provide the services, but we don't want that to be a barrier, right? So we try to take advantage that we have our own insurance, a lot of our patient navigators and our support team enroll folks in insurance. We have our insurance partners every day, so we have either Affinity or Fidelis, Metro Plus, Health First inside, helping to enroll insurers. One of the problems we had, our Medicaid numbers have gone down because due to the recertification, right? So that is a challenge. So now we have to do outreach efforts to make sure that people are back on the rolls. But in the beginning, when the new Americans were coming in, they were coming to us with insurance. And now what the city is doing, for whatever reason, they're not really enrolling folks in insurance. So
They were being enrolled at the various shelters. When we visited the Watson, we saw there was a whole section set up to
Metro
enroll people in Metro Plus to try to control this, so it was break the bank from the state. It's great,
And now some people say, this is more speculation, that the city's not doing that to discourage folks from coming to New York. Oh, they're not giving out insurance anymore, don't come to New York.
He's got the last word.
Out of curiosity, I know you're gonna be moving in and out of Community Board 4, so you're gonna be going north, am I correct as well?
I mean, we can go anywhere, I think,
Yeah.
I know it's.
Are you gonna be exempt? I know congestion pricing is coming around the corner, will that be adding to your? It's out of curiosity.
I have already applied for the non-existent not-for-profit exemption for our van.
Yeah.
It's a huge problem.
Okay.
The non-existent not-for-profit.
I can see you going back and forth and then.
Yeah, again, this is why we want to look at, I think before all these buildings came up, I think there were a lot of lots on 11th Avenue or West End Avenue that we could have, put the van in, but now there's fewer
A
lots.
monkey wrench is being thrown in, you're not.
Well, they would be condominium.
Yeah.
So I think we've had a good robust discussion on this.
I thought Mike, no, hold on.
Oh, Mike, I'm sorry, Mike, it's your hand.
Hi, can you hear me?
Yes.
Oh, great. Okay. I'm just curious. So let's assume I'm coming off the sidewalk for the first time to see somebody in your organization. Now I'm gonna get signed up, I guess, as if I were going to the center on 10th Avenue, the same way, right?
Yes,
And you folks can draw blood and do stuff like that. I would
Yes.
assume that the follow-up is gonna happen at the center rather than this person having to go track down the van again somewhere, right?
yes, but again, so if it's an organization that we're working with, you know, we would like to be scheduled, right? So if we go to Fountain House, I'll use that as an example, on Tuesdays, you know,
And patient follow-up may be at the van.
at the Fountain House on the next
But
Tuesday.
it's really just the Ryan Center on wheels.
Yes,
That's what it is. It's not about
Right.
going and soliciting people coming in and get something. It's-
and we're okay with them coming into the center, right? They might come into the center for a specialty visit, right? So we have dermatology, right? So we're not gonna have a dermatologist on the van. They're gonna get the center. So if they need to see a dermatologist, they will come to our center. But if they feel more comfortable, if folks feel more comfortable going to the van because they know it's right in front of Fountain House.
Where they're going for their day program anyway and having lunch. And
Exactly.
they
I'd
can
like
feel
to
the
make a motion.
So maybe.
I'd like to make a motion that we're acknowledging that the Ryan Center came here to present on this opportunity. And additionally, we are supportive of them going for the grant and recognize that it is very vital to the services they're providing to the community at large. And the increase of migrants to the community make it very, very vital to bring
Add
services. To bring services directly to where the need is. And we'll add all the points from the PowerPoint to support that.
And list all the community partners.
That was my question. How are you bringing it to the new Americans?
Oh, it's whatever organizations that we have, like, you know, a whole bunch of people that show up here and they ask, it's not gonna bring it.
This is about community partners. And we'll list the community partners in there. They're the various organizations that may say, can you have this van available on this day?
I think the only reason why it's important for us to mention the increase of actual clients is to demonstrate the need. So that you can show that.
So one example is we've gone to public schools to immunize children.
Okay, I just didn't know where.
Right, so.
Yeah, like,
That is just one
they
example.
can't get immunization, but they gotta get it.
So that's the motion.
There's a motion, second by Roberta. Any discussion on the motion? Mike, is your hand up on the motion?
No, his hand's still up.
No, take your hand down. Oh, here, all those in favor of the motion, please raise your hand. Now, Mike, put that little hand up.
No, Mike's on.
Oh, it's not like me, I'm sorry. Oh, jeez. Anyone present and eligible? Anyone against?
So there's a president.
I'm present, not eligible.
Oh, there we go. That was a test to pass.
That's it before you, that's it.
Yeah.
Yeah, sometimes I forget, present, not eligible. 'Cause I-
And all those opposed? Thank you very much for coming tonight, appreciate it.
Thank you very much for your time. Thank you, everybody.
Thanks for making the trip all the way down here.
Oh.
I've got a van.
Yeah, that's the man.
Not yet.
Not yet.
So our next item on the agenda is discussion about community advisory boards and when Jessica and Maria and I talked, we realized that we have not looked at this in a while. In general, Jessica initiated it because in fact she has to be the community advisory board of the Jeff Ryan Center, VRC, and officially the board chair. We want to talk among ourselves, determine the designated various committee members to be represented to community advisory boards. Some are more active than others. So Maria, you can take us through, that's a water type.
Yeah, I was just gonna ask you, Betty, were you able to hear Joe speaking?
Betty, did you understand me when I was talking?
Betty, can you hear us?
It's a little difficult. You asked the question, could I hear you all enough? It was at times a little hard to hear.
I will try to explain what Joe was saying. It's basically that in community, at some of our shelter sites, we have CAB, community advisory board meetings, that have our, stakeholders from the community. And, Jessica was at, BRC and she became CD4 chair. So that is when, we decided maybe we need to look at the list of the meetings that we have in the community. And as you see, I don't know if y'all can see in the document, with the shelter sites, the location, the providers, and the representatives that's supposed to be going to the meeting.
Janine, can you put up the document on the screen?
Sure, perfect.
While we wait, can I just tell Betty, your hair looks great? Second, yes.
All in favor? So most of these sites, the person who's supposed to be representing the meeting is me, and, I cannot do all of that, so I was hoping y'all could look and, does everyone in the room have the schedule for the meetings? How some of them are yearly, quarterly, once every month?
A question mark?
Yes, and question marks, because we don't know.
We don't
yet.
have yeah.
And in fact, the board staff will go check on this.
Yeah,
But is there interest by various individuals on becoming a member of CAB?
So Maria, you already have, the women's shelter on 52nd, right?
yes.
Okay. I can help you when you need if we figure it out.
So far, just, so like, oh, okay, thank you, Janine. So you can see the locations, the providers. There was one more thing I was gonna share is that, we're gonna be adding another one to the list, I believe. I'm not even sure who the provider is yet at this point. The drop-in center on 9th Avenue between 51st and 52nd. And I believe
Providers change.
the provider has changed. I believe it was going to be Urban Pathways,
Yes.
right?
Yes.
And it is no longer going to be them. I'm not sure who the
But
provider
they
is
haven't
yet.
opened yet.
No, they
correct? So-
haven't. However, I
That's because
passed
there
it,
is no provider.
No.
but I pass it pretty regularly, and I can say there are changes happening to the
Oh.
site, including like a ring doorbell
Doorbell.
outside. And I've been able to peek inside.
But it's amazing that the Department of Home Services is building a drop-in center without a provider to talk it all about how to run it.
Yeah.
I always get to build capital thing without an operator.
So sarcasm for those.
So happy to help on the ones in the 50s.
So you're happy to help is,
We have question mark for win, so we don't know.
You said, which site did you say?
Win.
First.
That's, thank you, Delora. And that is actually this one, Women in Need, I forgot how often that is actually.
Yes, because we don't have
I
the,
don't think, I'm not sure if they actually have a regular.
I don't think they have regular meetings.
We just pulled this together
Yeah, yeah.
for discussion starting.
This is the one that's Chris Quinn related.
Yes, exactly. And JD, thank you.
Yeah, the Clinton family residence on 49th Street. I think they're recent, they came to the block meeting a couple meetings ago, very nice, very open to working with the community. So we can find somebody,
Are you offering?
no,
You're a block away.
well,
I don't know how often.
I believe somebody's coming on the board who lives on 49th Street or on that block association, Katie Savage, and I think she wants to join this committee.
We have to wait until she turns forward first.
So we have a potential.
So Maria, for those of us who are new on the board, can you tell me what a local social service community advisory board is?
Well, you're not new.
He's a retread.
I'm explaining, basically. Short and sweet, I will say several stakeholders come to a meeting as often as they're scheduled and discuss any issues that are happening at the site and what's like what's the word? What's that word? Consensus, like how many individuals are there or how many vacancies they have, if there's been any issues. And sometimes you have to advocate for certain things when you're sitting at the table. For example, let's create a spreadsheet with the issues that are occurring and the outcome, or let's create a system where security is not just walking around in the building, but stepping outside or walking up and down the block.
When West 52nd opened up, there was no place to smoke in the building. We advocated through that group when it comes to the full board for a rooftop space. They were willing to go and smoke upstairs. When Lantern came on 51st Street, and they came with a plan that said the building should not be fully renovated. 10 people should share a bathroom. Right, Roberta, you can imagine my face, right, on that one. And they should be all walk-ups and they were combining two buildings for an elevator. We said, no, we must have an elevator and people should have as much privacy as possible, some compromise in between. And then when it opened and they changed their population and the population was severely mentally ill. they got more higher reimbursement rates. We had we had almost monthly cab meetings.
Yeah.
Because it was very bad on the block, and then it sort of calmed down. There's issues about 2 or 3 people, very violent. Council member got involved, like it was all through the cab that sort of coordinate that activity. And then now that one meets, you know, it's gone.
And I've been on cabs where they're meeting monthly or bi-weekly, it depends on the issues that are happening, and then they meet less frequently when there's more resolution. My experience has been when I have been on cabs is, it's an excellent way for the provider to get feedback. Also, and I would say, and or solutions to issues that are occurring. And so I think it's a good way to just be involved in the community and have a say, and sit at the table, understand more how a shelter site works. It's also informative.
And the biggest one we have on this is PRC.
Yeah.
Which has multiple shelter programs in one building that was heavily opposed by the surrounding community, and heavily questioned by this board. And really had a lot of back and forth and flares up from time to time with its management. There are just it's 325, I think.
And we said it should be no more than 100 beds.
Yeah, it's like 325 beds, multiple different programs, a lot of interaction, and until they got to open the rooftop, no outdoor space, and they just felt police in front of the building. So you can imagine, like, that was not.
So Robert, bottom line is that the CAB is an opportunity for community, other stakeholders to engage directly with the shelter. And it's a two-way conversation, so that the shelter is aware of the problems it may be creating in the community. And the community is aware of some of the difficulties that the shelter may be having in operating, and learn also how they can be supportive.
Vice versa.
So that it actually works for everyone.
Yeah, but I think more important than this committee are the local people who see it every day.
And those people are on the cabs too.
Right, so, they should be listed as well.
No, this is our rep, this is what our,
Oh, we're looking for community
rep.
board rep.
No, all these cabs are set up, they exist,
Okay.
and they come together on a regular basis. Right. We have not looked at our community board representation. And I think what we'll do is we'll come back with this in between, give more information about each facility, describe the population that's going on. And then we can see if we can match up some members of the Housing Human Services Committee to act as the community board, the new community board rep. That's it. No, these cabs are set up, the block associations go, the precincts
Yeah, I was
go,
gonna say
all this happens already.
I was gonna include that it's neighbors who live in the community. I've been at some cabs where there's the local police precinct present, some, not all of them. There'll be a representative from DHS.
Oh, yeah, tenant association.
Tenant
show up.
Yeah, and it all depends upon it depends upon what's happening with which facility at the time. And what degree of, but when there were serious problems on 25th Street. Wow, those were big cabs and everybody was there, like multiple police forces. So again, we'll get you more information, but think about it.
I'm just curious, what is it, Washington, Jefferson, sit in this? We have the migrants.
These are
These are
permanent,
shelter.
either shelters or supportive housing that was troublesome. Okay, we have not at all figured out yet,
Yeah, they do.
because which district has this many shelters?
Yeah.
Like we're number 2 or something?
See, his voice is cracking, and so it's hurting him.
Somebody told me, I'm not, this morning said, puberty.
Again, 51st, thank you.
But it is, the problem is, these are direct,
Yeah, it's not.
it's not,
I'm still writing it because
yes,
there's always some changes happening. For example, a shelter that showed up on 46th Street that Eric Foster's office didn't know was
yeah,
there.
yes.
Until I said, hey, I think there's something here, a couple of times.
The HPD took over a hotel on 46th Street.
So there's always changes happening, it doesn't make sense right now, but, I just wanna explore. these.
That's why we talked about another.
So these are just shelters?
These are specific facilities that went through some public process that agreed to do a community advisory board as part of their approval that came to us. Yes, and we're like doing like an inventory kind of thing. No, inventory, checking it out, but it was prompted by Jessica having to leave the cab.
Yeah.
Gotcha. So.
Roberta said expression.
Sorry.
What is the way that you would like interest expressed to you? And is this a request that is just for the committee, or would you like it made to the rest of the board?
I think it starts with the committee and see how we can provide reps, because we're supposed to be the most involved in this, and thinking about what your time ability is, you know. And these do meet during the day or in the afternoon.
No,
Really?
no, I think some meet in the evening.
I think there's more that mean in the evening.
Really?
Yeah.
Oh, I
Oh,
I live in the
It would help us to know.
all that information.
The full schedules, both when the cabs meet in their, I guess they meet in their committees. Separate from the shelters, or they meet the shelters at the same time every time?
No, they meet at the shelter or a designated location adjacent.
So is that meeting, is that first meeting?
Yes.
Yeah, I think we need to know the schedule.
Sure.
And how frequently.
I can't remember.
So what you're hearing here, reason it's not fully fleshed out, is because we got Corey across from Jessica, and then we just spread out to say this is globally.
So we'll come back to it,
Yeah, just wanted to bring it up.
but in spirit, very interesting.
Yay! In spirit as well,
Yay!
but.
Like such a
I
spirit.
knew that spirit was here.
Yeah, you can
I
spare.
think if you want some day jobs.
In spirit, I'm also interested in spirit.
We'll see in spirit as well.
Okay,
Need to know
Yes.
more.
He needs to know more.
of course.
Wilson, was that interest?
In spirit.
In spirit.
The one on
Body.
I'm writing your name down on the side, so okay. I
I
wrote
just need to
Roberta.
know how often. I just need to know how often. How often. they
Yes,
meet.
I know, oh, you're gonna get that, Travis, we'll get that. Oh,
Maria,
we'll share the details.
one more piece of information that might be helpful if.
Yes.
Is if the meetings are at all hybrid.
Yeah, I wrote that.
I'm guaranteeing you a lot of,
That helps.
of course. So again, we start this conversation off, you take it from there.
Okay, very good. You need your voice for this.
I use fingers.
This will be.
You can do sign language.
Really done for me.
Okay, so,
Make it simple, please.
yes, I want to talk about why we're talking about this all first.
You have to explain it like you're explaining it to Gabriel. That's my son.
But in a few words.
In few words.
Yeah, so, Janine, take the thing down,
Please.
please.
Do we need to put something else?
We will listen. So, we are starting a discussion tonight to help us prepare for what's coming in Chelsea next, okay? And this is not about decisions, this and whatever, it's looking back first at how we achieve consensus and information about the Chelsea Mutual working group. We put in the Dropbox, the Chelsea NYCHA working group report. Noted that it's pages 19 through 35. And what I wanted to was through on a couple very key points on this. And then we're gonna get even more interesting and show you the whole financial thing that we set up for this, right? So, remember that what you're looking at was a tool, right? It was not just the final of anything. And we certainly know this day is not the final, it's something else, right? It was parameters, right? But I want to skip first to the very end pages of this, where so, and a lot of these things tied into finance, right? So there were some principles and recommendations that came out of the whole financial structure. One is that no system, and I apologize for talking about what happened then. I have to talk about it then to get understand where we were, let alone where we are now to where we need to get to. That no residential buildings will be demolished. Number two is a key financing issue on page 36, that all financing generated from this proposal was to be used for the Chelsea NYCHA developments. A very important thing, no matter anything that was generated through capital financing will go back here, right? That the tenants are going to be continually involved, period, throughout the whole process. And that any development of any infill, new construction, must balance maximum capital financing for Chelsea NYCHA while respecting the NYCHA campus and the neighborhood context in height and bulk. And infill development must balance a range of affordability with minimum market rate units to keep comprehensive renovations at the development and NYCHA development financially feasible. And the last one is any infill shall have 50% community preference. And within those 50% community preference, it is a range of affordability. So these were basic issues on how creating any additional units. It was to benefit the financing for the renovation.
So this is agreed on,
This is the Chelsea Working Group report, which the entire working group supported, which the mayor took, published,
Okay.
which, and every sector involved in this, and the sectors were the tenant association, the mayor's office, the elected officials, all the community groups, the community board, the resident tenant associations, the people who started out against it, voted. Yeah, I'm gonna say again, the groups, not the individuals, the groups, right? And I'm gonna say again, the groups. The Citizens Budget Commission, the Citizens Housing and Planning Council, the citywide groups, right? Broad.
So,
Oh, yes.
Joe, I just want to stress that we're residents, there are residents on here as well.
I don't think we need to debate it. We got it.
I'm just saying, not on the tenants association board, but residents.
Yes. In the working group, not just the tenant association. Yes, I know. That's why we're not gonna debate it, because we know it, right? Again, that's a rabbit hole.
You gave me a threat that if I would decide, to go against the Rat Pack, you said that I have to watch my back.
Okay, I'm gonna say again, no one gets to use this meeting to have a side debate, this discussion, and that's, you included.
Yeah.
This discussion
Yeah.
is about getting information out, getting our membership educated, public educated, so as we go forward, we are informed on a process, right?
That's great, Joe. Just, so this was voted on by a bunch of people, not the board yet, right?
Yes, JD.
And the board.
JD, the board, this Chelsea NYCHA working group report
Right,
came to the community board in 2021.
okay,
The community board had multiple meetings and hearings about it,
right,
presentations,
okay,
and the board took a vote and endorsed the report.
okay, gotcha.
So this is the board's position,
Okay.
and it's not changed. And now we're dealing with a new plan and we're engaging, right? So, and we agree that's factual, yes.
Yes.
No, what's the next one? I think, but the question is, how did the whole approach work? And the approach worked specifically that we looked at what was the capital need for Chelsea NYCHA, ultimately Chelsea. And the capital need number at that point in time was 336 million. And that number was from a total capital needs assessment by NYCHA done in 2017. And I'm talking about processing, not today. And the goal was to solve that number. How do you do it? Multiple components all over the place. And I had to look back myself, because I looked this in a while, to see what, what was the strategy? What did we do? So solving for $366 million. And along the way, we had issues.
366 or 346?
366. Yeah, along the way. First, there was no improvements to the heating system at all. And the working group negotiated, including the heating system. That was a big issue. And that was a discussion with the chair of the Housing Authority, Gregory Russ, at the time. And so $18 million in part of that 366. Unbelievable, given Fulton's location, there was no discussion about resiliency for floods. And we got that put in toward the end, and there were 6 or 7 of us that just held on to say, you have to make it resilient, you can't renovate something and not, do that, right? So we considered these financing strategies. Public financing, money from the state, from the city, federal or state. Transfer development rights, because it's not fully built to adjacent sites. Redeveloping the ground floor as retail to bring in income, because of course, the average changed dramatically. A lot of good rent coming in to support. with the resident management corporations. That was an idea, actually tenants taking over the London model. You look at the West Chelsea Affordable Housing Fund, that is money paid in to a fund specific. The Highline is a Highline, when you have a certain bonus, you pay into a fund for the Highline. When that Highline fund was met, you then started this new affordable housing fund. There's about $1.8 million, right? And then we looked into mixed income residential infill. That idea, partial market rate, partial moderate income to bring money into this project. And the thing at the end was the biggest, and that is apt conversion. Taking it from section 9 to section 8. And the key issue here is buildings that are owned by a public housing authority cannot take on a mortgage. The normal and standard way for there to be improvements, whether you're a middle income co-op or Parkchester in the Bronx or Co-op City, you periodically go out and take a mortgage, refinance the building to do improvements and keep it up to date. That's how buildings work, rental buildings work, and
They pull the equity out of the existing asset in order to go ahead and continue financing improvements.
What's the resident management corporation?
go back in 1 second, the mortgage part first. So this means that when a housing authority anywhere across the nation owns a building, controls it directly, it cannot go out and get a mortgage to make improvements, put in new windows, new roofs. Now, I will tell you, I've done this work for decades. That particular part, I never knew until I was working with. So that means that the housing authority in the city of New York could never borrow money, right?
So that allows for dilapidation.
What?
Does that allow dilapidation of the building?
That's it, well, the reason the whole idea was, you don't have a mortgage, you don't have a mortgage because it's public housing.
Right.
And the federal government and the state government would provide actual investment, right? The problem, Alexa, you can't keep talking, you should raise your hand.
Alexa, the only thing is that today is extra, tough to hear Joe because his voice is all messed up. So there's people online who are also listening, so whenever you're talking, it makes it harder to hear him, so you will have an opportunity.
Look, I'm mumbling to begin
Wait a
with.
minute, don't do it harder, so you'll have an opportunity to speak, okay?
I'm feeling very uncomfortable the way this conversation.
Okay, I would suggest if you need paper, I'll give you paper and a pen so you can write down the points you want to speak about when it is your turn to speak, okay? If you need that, let me know.
So underlying all this was this RADPAC conversion to do two things. One is it would allow borrowing, so there could be a mortgage to the property, right? But second, by converting from that section 9, which is public housing, to section 8, this particular program, RAD, the Federal Rental Assistance Demonstration Program, allows the new manager, operator to go and get the rents restructured, raised, not what the tenant would pay, the tenant pays 30% of income. But if it today, under section 9, a 2-bedroom gets paid $1,500 in subsidy, and the tenant pays 30%, right? This means they could get much more, they get $2,000, $3,000. And when you get more income, you have the ability to take out a mortgage against the income. Does everybody follow that so far?
No.
Just general.
Yeah, I'm at the point there, so.
Let me do it in like, not real numbers.
Okay.
Yeah, do it in if you want.
Today, the total annual rent from Fulton, the $100,000. I don't believe it's a made total, right? Yeah, for all the buildings, let's say, right? If you take that from section 9, if that's how much section 9 pays, the tenant pays the 30%, the federal government pays the rest. Moving to section 8, that total rent could go to $300,000. Because they
Paid by
would,
the government, by the Fed.
in both cases, the feds are paying the subsidy. But this pot, section 9, is underfunded. This pot, section 8, has a lot of money in it.
Right size.
And why does it have a lot of money in it? Because it benefits not just public housing authorities, it benefits private operators across the nation, and Republican operators like it a lot. So there's money, right?
So then my question still is, but I think you kind of explained it, but I'm still struggling.
You go ahead. That's what.
Yeah.
So how are tenants not adversely impacted by, how they're not paying extra rent by this increase?
They're not.
But then just explain to me how. So,
In these kind of buildings, as part of a conversion from section 9 to section 8,
mhm.
tenants continue to pay 30% of their income for rent.
So it stays fixed at their income.
At their income level,
Okay.
not the value.
So not the
of
value of the
now-
building,
now
but their
change
income
the
rate.
value of it.
Right, okay, got it.
And then as part of it, everyone was very concerned because in NYCHA, it's a flat rent, you go up to a certain amount, you can't higher. And same thing happened in Manhattan Plaza,
Mhm.
right? So that got worked in as a tenant protection. That if you are making, if today you're making 30,000 and 2 years from now you're making 60,000, you're not gonna go up to that. You're gonna take a hit, it's one cap across the board.
So the cap's like 40,000.
I would think, but it's a protection that you're not.
So essentially, the section change allows a new assessment of the total amount of subsidy
Mhm.
that can be put in. So you're reassessing the value of the property.
No, it's not the property. Let me tell you how it works, really odd how it works. It's done by the market. This program is also called Mark to Market,
Okay,
right?
all right, that makes
So
sense.
you as the owner, go out and do a market study. What do rents get paid in the area? I'm in Dubuque, Ohio. The top rent in my section 8 will be $850. I can get 1,100 in the market. I prove to the federal government, HUD, that's 1,100. They now will pay me the difference between 30% and 1,100, not 30%.
Yeah, we're almost saying the same thing. Essentially, what's happening is it's the same as if you were to get your house reappraised.
No, it's not the value of the property. It's all disconnected.
No, but you're
It's the
saying.
rent, reappraisal of the
No,
rent.
but it's reappraisal of the rent, of what would that be rental be
That's
in the
right.
market,
That's right.
right?
It's like the income of the building.
Yeah, yes, well, no, it's not on the income of the building, again.
No, it's not what they're gonna take
Yeah,
in.
the whole,
Market price.
and the whole idea for when it's a private section 8 was to keep owners of section 8 buildings in the subsidy market, not to kick out all the tenants, right?
Right.
But in NYCHA, in the public housing authority buildings, it's about, we can make these increases. And that allows the private operator to go out and borrow,
Yeah.
get a mortgage and bring in money to
We can
capital.
think of it as for the building owner as a cost of living adjustment, meaning the market has changed.
Yeah.
We're not changing anything for the actual tenant of what they're paying because it's based on their income. But we're saying that in this market, this type of size, this type of square footage in this location with the
Right.
medium income of an entire area,
Of a zip.
I probably would be able to go ahead and value a rental at this level.
Right, and it's important to say the owner, because in many cases, of public housing, the owner stays at the housing authority. And there's a lease or an agreement with an operator, so it's always, in our case, in the west side here, definitely, in our case across the city. There's no sale of NYCHA land, there's a 99-year lease of
So
the
this
property.
just creates more leverage for whoever has the operating of this building. So that they can then go ahead and use capital markets, borrow, et cetera, whatever it is. To maintain at current rates. Instead of being stuck with that they're only getting a subsidy at a much lower rate. And really, that's why
And-
section 8 don't bother fixing up their space.
Right, so that's what I was trying to get to, but.
No, but they do, and this committee has seen multiple section 8s come. Number 414 West, 424 West the 8th Street, and 326 West 53rd. They came to this rad thing, and it was specifically, they wanted to stay in the program. But also, if you have a small functional building doing upgrades, you get more rent, you get more profit. Right?
As the owner.
Right, and remember, it's coupled, you must do renovations, it's not just the
It's a
money.
must.
Yeah, it's a must,
Okay.
you must.
And at least on both, the distinction between section 9 and section 8, when it comes to the lease period is 99 years on both, versus 99.
No, this is that's for the property, this is the tenants have regular leases.
No, I mean, I meant like the land, I meant the property.
Oh, probably.
So there's no changes that can occur to the style of the property?
No, there, in section 9, there's no leases. The public housing authority owns the property and operates it.
Got it.
They create a lease for section 8, so a private sector operator can operate the property while they retain the ownership.
So I want to ask a question that just came up on what Travis said. Where's the enforcement on ensuring that these changes are, these improvements are done?
Right, so any section 8 conversion to this bad stuff, highly monitored. The local agent, the local housing authority or housing department hires firms to monitor that. Not only, first of all the process is managed that there's a submission of what's going to be done.
Right.
That's reviewed, back and forth about the review. After that scope of work is agreed to, then it's embodied in a series of specific regulatory documents.
Federal?
It's on the, there are federal requirements in the documents.
The reason why I'm asking is these are NYCHA buildings. And the reason why I'm asking, these are NYCHA buildings. NYCHA is, if we think about it just generally, is a housing agency.
They're a public housing.
They're public, right, but it is a housing agency. And then we also have the housing, with HUD, right? There's the federal.
But supervises NYCHA.
And then we also have, HPD.
HPD is not part of this regulatory change.
Okay, so that's what I'm trying to clarify. How do we at least let folks know that this is going to impact where that oversight is for this additional stream of funding that can come in for these improvements to ensure that give it some assurance that there is oversight and who has that oversight for making sure those.
There is regulatory oversight at NYCHA and at HUD every step of the way along this process.
I would imagine it's very good.
Yeah, to that same point, I like to what's the education to residents about who they're supposed to contact when they have issues?
And there's actual documents and requirements to give not only notice, but to let tenants know who, how, and when to make complaints to. It is specifically set up in that. I can't even tell you how.
Can we get an example of those? Because I want the communication to be very clear and upfront and easy to read, and not like a 200-page document we need JD to be able to interpret.
Got it. So
I'm struggling right now in the conversation I have one. So
what I want to do though is keep bringing you through it because that's the kind of questions I want to get out there.
Yeah.
So before you go on, John, there's one part, a question that Travis asked that left me a little confused on the reply. I understand that the rent increase is coming from the federal budget.
It's the rental subsidy.
Right, the rental subsidy is coming from the government, not from the tenant. But you said that if a person's income went from 30 to 60,000, there was some sort of cap on their 30%. I didn't understand that.
So, in section 8 projects, right, there's a concern, I come in today, may get a very low income, but over time, I better myself when I make more. And in a lot of developments, there's a cap, meaning 1 bedroom, 2 bedroom, 3 bedroom, whatever it is. You're not gonna, even though 30% of income would be more, you would never pay.
More than the 1 bedroom.
Right, no, not the 1 bedroom.
There's a cap.
Then a cap.
There's a limit for that particular size.
There's nothing to do with a fair market.
So let's say 3-bedroom, 3,000.
Okay.
That's the most you can charge.
Even if you make 100,000.
That's the most, and this comes from HUD, this is
Yeah.
HUD rating.
And then it's called a flat rent. That's the term in that to protect people, okay? So we looked at that. Then we said transfer development rights, right? Well, that's good, but you can't count on it because it's not gonna, you don't know if it's gonna get built next door. So we did not include that with the financing. We did include ground floor retail and community facility. We felt that in both campuses, there's an ability to create retail, which was unbelievable in Fulton. The ground floor is Hudson Guild and the boiler rooms facing the avenue. That's what's there, which makes no sense.
Wow, avenue.
is there a recommendation for the type of retail, like the level?
Yeah, there's a there was a whole broader thing about community based, or whatever, but also remember, this was retail to bring income in.
Right, no, I get that.
Yeah.
But what I'm trying to say is that the retail needs to be at a level in which it both is affordable or at least within range of the people that live there, but also able to attract additional income.
It was the opposite. In this whole working group, that retail was not for that purpose. That retail was to bring highest and best use in, to bring in commercial rent. It was not about the
Free market commercial.
Yeah.
But one of the requests that we made
That's
is
right.
to have an affordable supermarket there and recommendation to have a medical center
All
or
these-
office there as well.
Right, so in other words, was discussed at length for months and months. And everyone fell on the side of, if we have to make sure we have enough money in to pay this mortgage, the renovations and improvements, gotta get that there first. And then there's other space that can be done for a supermarket at a second. It was a really amazing discussion. The resident management corporations, that was a presentation done by, Citizens Housing Planning Council about the idea from London, which tenants were deeply involved in renovation, and it actually became, it's not ownership, it's similar to ownership, right? And a lot of discussion about this was specifically brought in, and the day, the whole group said that was not gonna work at these locations, because the capital need was even deeper than we have in the UK. And there's a lot of debate, not like one or two discussions, like 12. Chelsea Affordable Housing Fund, there is money sitting there. It comes in, he said, from here on goes to NYCHA. There's 1.8 million sitting there.
Is that actually done?
Hmm?
Is that already, that designation for
Yes.
the campuses is already made?
That fund exists, and there was like an agreement, the mayor's office said they would. A huge discussion was about infill construction. And what that could be. By doing mixed market rate and affordable housing on site, that was gonna bring money in. So, and we spent an incredible amount of time, and you will see on the maps in this section, these pages 25, 26, to find a fitting mixed income infill construction at a scale that is not overwhelming, that would fit in, and that would create value to contribute to the overall pot for renovation. And at the end of the day, the RFP only recommended 1 or 2 sites, seeing some of them are too small. I had a very long discussion with a number of developers, private developers during this period of time, where NYCHA said nobody would build a building under 100 units. I'm like, have you been in our community? There were these weird discussions where they simply were not connecting. If I said, did you look down the block or over here or over there, and the whole idea was is that you want to bring in, if you have to have some market rate, it's got to be balanced. Now, that was the next discussion. This whole idea of, there were many people who said every mixed income building should have the lowest income tenants in it, and then market rate. And that, there was a back and forth about this. That would have meant more market rate housing and less affordable housing, because you're going to the deepest level. And he kept saying, we're preserving the 2,007 units of the most affordable housing, which is the NYCHA housing. And that's the low income cohort. We want to bring in moderate middle income in those affordable units. And at the end of the day, after a very serious debate with the controller's office, the group prevailed. And that would be 50% market if it were built, and 50% moderate built. Type of truly mixed income community.
50%,
50% market, and the other 50% would be moderate middle. So then on the campuses, you have
Your deep affordability.
you have moderate, middle, and market. And that was, I'm talking about at that time, right? And then we also put in the Hudson Guild site, specifically saying how that's structured. Build a new building in front of the Hudson Guild as a new Hudson Guild, and build the building over it. So we figured out ways to shoehorn things in that met all these different requirements. So I just bring this, that sort of broad, here's how it happened, right? And This meant that there'd be 348 new units, 70 moderate income, 126 low, 52 high, and 348 market rate units. That's what the plan said.
I'm sorry, I need clarification. Yes, missing something. So it was 50% market, 50% moderate middle, and the rest.
I'm gonna say this again in a different way.
Sure.
First, we preserve the 2,071 units
Right.
of NYCHA housing.
Yes.
And one of the elements of preserving that was to build 348 units of middle, moderate, low, and 348 units of market rate. So-
In the new building,
In the new buildings.
and the old buildings would be for
The renovated buildings would be for the current NYCHA tenants.
So the current NYCHA tenants, according to this, do not go into the new buildings.
There were only 2 units.
Gotcha.
At the time, only 2 units.
Gotcha, okay.
Because the whole idea was, we did not talk about how to integrate the NYCHA buildings. For the simple reason that the NYCHA tenants didn't want to, at that point, wanted to demolish, didn't want to move. So we're not gonna mess that up.
So that was at the time.
This is at the time, meaning the adoption of the report,
Right.
which led to the RFP,
With,
in which lady was chair.
related thing.
Right, the RFP what I'm talking about here.
Yeah.
This was in the RFP. Not like a maybe.
So this was gonna be then 2,071 units of night units,
Reserved,
and about 700 and change of new
that's right.
units at split, 50 affordable, 50 market.
Right, so,
Moderate, I'm sorry, moderate,
right,
and the other are market. Okay,
right,
so
so,
on a percentage basis, the new is what? Is it-
25%.
Yeah,
it was a very small amount of construction, and of that, 348 units of market rate house.
right, okay.
And how this worked for a second. And then we'll put it on the screen, so you can see it. And so this was the tool that this committee spent, how long did we meet? A year and a half?
Yeah, almost.
Yeah, the problem is we started meeting and then COVID hit.
Yeah.
So we met during COVID on Zoom, it was like this,
That's a working group, Joe, not the committee.
the working group. You see, the working group.
Sure, I'll turn it away. Take it the other way, so this is
did.
easier.
Oh,
There you go.
well, I did it again, all right.
There's a hurdle.
Yeah.
You know, I forgot how to do this stuff, but I'll do my have to do it for me. I don't use flashlight often.
No, bring up the little carrot.
Yeah, that's what I'm doing. And I know it's the D, so I can get it.
So while that's being pulled out, what exactly is our role or ask here with respect to this agenda item?
So as we continue, Rachel, to come into, we now done DIS, right? Now we're gonna
Right.
be moving into a ULIP. There's gonna be versions of this plan coming back and forth. What has been brought to us and brought to our neighborhood, our community board, is that the plan that was adopted is not possible to be done. Right. Because the capital need and the cost of it has changed so much. That after some discussion internally among tenants and, a NYCHA developer, the idea was just build everything new. So the underpinning of this is it costs too much,
Right.
right?
Of the plan that was adopted, this one.
Which was 366 million.
At the time.
At the time, which is 2017, before inflation went up, and before rates to finance.
Right.
Sure.
Basic.
So,
Still increasing.
so they're not still
Never
increasing.
ends, never
They're not still increasing. Hold on a second. That I know for a fact, because
Yes, the labor, materials.
that's.
Yeah.
Yeah, I am having Janine. Janine, you there? I'm being told I can't sign into Microsoft.
You can't send it to where?
I can't sign into Microsoft. Like, do you have a sign in?
I'm
You want
not
to,
sure why. What do you need to get?
I have a flash drive and I'm opening up this large spreadsheet for people to look at.
You putting in your Microsoft account information?
Hmm?
You're putting in your Microsoft information?
Yes, I don't want to do this on the screen.
So take, take it off your. Sign into it and be sure it's real.
There you go. Well, no, you're still sharing.
You're still sharing.
So
It'll probably dot it out, won't it?
No, just
No.
in the Zoom, just hit, go back to Zoom and then stop. No, you're not.
It's right there.
Now.
I'll stop sharing.
I was.
You were sharing.
I was just sharing. No, I wasn't sharing.
So why is it, oh, it's because you're doing it directly from, so unplug it.
Yeah.
What?
This.
No.
Here.
No.
Oh, it's over there. No, that's.
No, that's for the
So now that
projector.
it's not on the screen, just go ahead and.
This is the projector right here, no?
No, it's not with the projector problem. It's.
No, this is the projector.
Oh,
I
they share.
don't know. No, I think it's still gonna be shared online.
I'm
now.
not sharing, it's not, it's just running the meeting.
Okay. so-
Projector here.
So you know what?
Isn't.
Are you logged on to the meeting?
Just go to any
No, no,
Excel
no.
file, any Excel file and sign in that way, blank spreadsheet.
No, he doesn't want his sign-in credentials on the screen.
I know what you're saying. I think you're supposed to be able to view it without an account, not edit it.
Right, right.
Sure.
This is friendly.
Yeah, it's it out. It keeps popping back.
Anybody wants to do it, give it a go, I appreciate that. Cause I worked at it where I came. It makes no difference. I'm shy.
Yeah, it still projects everything.
Yeah, it's because this is connected directly to the. Mess with it, don't put too much hope.
Oh, well, actually, it's showing now.
I'm showing it, okay. All right.
Yeah.
Okay. Thank you, just for that, good screen, appreciate that. I think I wanna just give
But you're
you,
not sharing, so people in the meeting, in the Zoom can't see it.
okay. So,
Do you have to share this?
Janine, can you see what we have on the screen?
Probably not.
I can't see it, but, I'm on.
Okay, yeah. Wilson said he cannot. Okay, so that's great. Thank you,
I think
Janine.
you got it.
Yay.
Okay. Now, I just wanted to show you a very little bit of this, but how this, the amount of time spent here. So, this was a solve for something, right? The task that was given, the capital finance subcommittee was, it's gonna cost 366 million. How can you come up with that? And we spent 18 months going through different scenarios to figure out how to come to it. You can see here, this is shortfall 0, surplus 3 million. Okay, that took months and months and months.
The working group again.
The working group, the capital finance subcommittee of the working group, right? And that was adopted into this plan in detail throughout the whole thing. But what I need people to be able to understand that's gonna come to this committee is that the presentation in front of us is that the amounts, let's go to that for a second. This is the capital needs summary, right? It lists, check this out. It lists Chelsea, Elliott, Chelsea Addition, and Fulton. And what are the various capital needs, right? That all came together. And that added up to the $366 million. There were some discounts against it because the city, there was capital money already spent in the project. The capital needs assessment showed things that were already completed. They had to come out. And that got us down to, and then we added on an inflation factor, right?
Well, at the time we've got,
Well, no, again, this is at the time.
yeah,
We're gonna have to go through something like this again.
Yeah.
Time, right? And then the heating system came in. So added on, and that got us to this 366.
And that's 366 in 2017.
366, it's on 2017 needs assessment.
Plus the increase.
And yes, and it was done in 2021. It was 2021. Okay, all right. No, and by the way, just so you know, if you think the housing authority, super conservative, every assumption here, every bit of anything was either factor less money coming in and spend more money going out. So this was not some sort of like airy, you know,
So in theory, this is over 400. Like,
So right now.
in real time, this is over 400.
So one of the things our community board has requested is the updated capital needs assessment. Not just a number saying that it's $1 billion. Just last night, we received that.
Oh, great.
So I cannot bring it up to anybody yet, because I got it at 10:30 last night, so I thought maybe we should look at it a little bit before putting it out, right? So, and there's a meeting tomorrow night to talk about, right? The other items here, you see, there's a list of infill sites, right? All different locations where things could be built. And this particular analysis enables you to turn things off or on, depending upon if you're gonna use them, right? And that helps us understand where things can be built. Further. This gave you a full mix of all different types of units and different affordability bands. And you can choose which affordability band to get the most money for NYCHA to be able to do renovations. And that's how we hit on that mixture of 125 and 165, and some low income units.
But this is no longer based on the number of residencies in that 2017.
It has nothing to do with 2017.
Right, I'm saying it's not based on that 2017. Yeah,
No, this is for the new construction.
right, okay, and the total number of residents in that one is.
There's 7, sure, something.
And the AMI changes annually though.
Right, so again, these are the old AMIs, right, for that period of 2021. When we look at this going forward, 2023 has gone up substantially, both on the AMIs, but also on the subsidies. So I also want to note, our community board received last night for the first time, the new Section 8 subsidy rents. So if you look here, and again, you have to analyze this, understand it. And I think this is a important bit. That NYCHA had this group use saying today, before RAD, they get average. These buildings have between studios, 1, 2, 3, 4, and 5 bedrooms, right? So there's a whole range of rents. An average, Section 9 paid NYCHA $613 a month. Right? By development. With the subsidy, $13.54 a month. That's exactly paid.
The next column, yeah,
Right.
column G, okay.
Right there, right? And when you increased it, this post-RAD conversion, 2 different types, $15.56. I believed, my colleagues believe, this is a very conservative number. Boy, were we right. So I don't have the averages, but I can tell you the broader rents that will be sought here for Section 8, they range from $3,000 to $7,000 a month.
For those 5 bedrooms.
For those 5 bedroom apartments.
Which
Because,
nobody builds.
because again, and nobody builds 4 and 5 bedroom apartments anymore. Those are like gold to our community, right? And this means, especially for multi-generational families, those are really important apartments. So this means that there's gonna be much higher rents. Now, we don't know what the impact is on all this around, but this is the kind of things that these all play together to say, the more rent you get from Section 8, the more money you can borrow. And then you can see the rate here, look at the rate floors. 3.5.
3.5.
Now, what's interesting though, is that these are not real mortgages, these are bonds.
Right.
So today, the bond yield is like 6%.
Yeah,
So it's not like it's, it's a different story, but we'll look at it, we'll go through this, come back to the committee, have discussions. But the whole point is, as you change each one of these numbers. So I'll do one little change to see, let's say this total rent here is not.
you may not be able to edit.
I am. Oh. I can.
We could try.
Yeah, so this total rent is $38 million a year, right? I make that 45.
Yeah.
That's $3
But we believe you. We believe.
I know you live. No, the point is, Rachel, all of a sudden, it changes.
Right.
And he's done changing, right? So that's what's gonna start to come to this committee, because the underlying thesis here that we've gone is that there was no way to do renovation. The renovation is way costly on a per unit basis. Well, one of the things we talked about at our full board meeting last night is that we really should not be using per unit basis anymore. It should be square footage, because when we have this many number of 4 and 5 bedroom units, these are large apartments, and you can't, they're not, it's has the apples and apples, right? So if it costs renovation, $350 a square, $350 a square foot in 2021, let's see what it costs today, what it's about. And then we don't even know yet, we haven't looked at it. Are the two project needs assessments equivalent? There are a bunch of line items. How to look at that.
So one thing I think will be helpful, going forward in helping, everyone to understand is to create a little bit more simplicity around this
Yeah.
breakdown. And I think that what people might
For
be,
sure, first. No, too much.
yeah, it's too much. I think people, may need visually the opportunity to see cost then, cost now,
We have pie charts that did that before.
right? And I
That's
think.
helpful, right?
And I think that in the same way that when you wanna assess people's pain levels, you have varying levels of different little smiley or frowning faces. I think that this may be an opportunity to explain how in just a span of 6 years, we'll call it, that the world has changed and how we can actually get something done, has to use different mechanisms, right?
Right, and part of it is to make sure along the way, we keep comparing apples to apples. So I wanna make sure, it's all the information we're starting to get now, we started this suppositions back in 2021. Are we looking at the same set of suppositions?
Yeah.
So if I hear it's $556,000 an apartment for renovation, so therefore let's do the construction. I wanna look at it as how much it is per square foot before versus today, because the very large apartments, I think there's like 72 4 bedrooms in Fulton, like, I mean, there's very large apartments in the two complexes. So that,
Yeah, I think.
it's how you present the thing.
But, right, and this is a lot of information. It's extremely dense. I think that, I mean, I don't think most of us here are really grasping what you're telling us, to be honest.
Well, that's important to me here.
Yeah, and I'm just being
No, because
honest,
the message has gotta be simple.
right?
Well, the truth that, I mean, I was telling you, he was a JD and an attorney and a social worker, and he was having trouble understanding, so.
No, I think this is difficult for anyone who's not in the business to understand, right?
Right,
That's
but,
exactly it.
but let's step back, and therefore, it's difficult for anybody who is a tenant,
Yeah.
no matter where they fall in this
But
process.
we're the same level as anyone who's a tenant.
No, I think I was gonna speak.
So in any case, what, I think going forward,
Yes.
we need to figure out how to completely simplify the change, right? As the level setting, and then the actual financial opportunities and those differences between moving in those directions, like literally, doing this would cost this now, doing this would cost this now, doing this would cost this now.
I think there's someone on the board who does financing for a living and who can like help make it real simple.
I was
This- yeah.
No, so.
That's not exactly what I do, but.
No, so what I wanted to know, what I wanted to know, during the entire working group process, this changed so many times. No, these opportunities came up.
Folding the
No,
quick
no,
thing.
no.
This is just saying what I think that we need
Yeah,
to
well, I
go.
could get from you. In the groups we did is, first Savannah Wu, community planner, she created all these little pie charts that made it very easy for people to see, you start here, this change, that change, and it helped the full group consume and understand. That to what was before, to propose now, is the right way to go.
Just as level set, but I think more importantly, a very, very heavy emphasis on the now.
Yeah.
Yes.
I understand why we went through this exercise to look at what we were looking at before, but I think it is so detailed that what's getting lost is where we're gonna have to move forward.
I think that, I
Yes.
really wanna kind of drive that home is, it would be helpful to know where are we taking this? What is our goal? Is this gonna do anything to not just current plan? Like that's
Yes,
as a
yes.
newbie.
Okay,
And
so-
Also confused JD.
What is our goal?
Yeah.
Our goal is to look at, in the same lens, means and methods and process we did originally, the current version and the needs. Understand what is being reported, that X, Y, or Z can or can't be done, because these are the new financial needs.
This is just to help our understanding
That's
of
right.
what's being presented to us.
Right.
Oh.
Yes.
And we're gonna be getting members soon,
This
so
was
Joe will
prep.
have
This is
another,
prep.
Joe will have another opportunity.
Yeah, no, this is, remember, community board is at, let's start full context. The community board has asked for information since the last year.
Right.
We are starting to get it very small. We asked specifically, how many studios, ones, twos, threes, fours, and fives in each building? We got it last night.
When do we get to see that?
Huh?
When do we get to?
After this week, I was meeting with NYCHA tomorrow, but like, think about it for a moment. We need to think about what this
How to
means,
digest.
how to digest it,
Okay,
right?
got it.
And also, we've asked the question over and over, going forward, are the unit sizes changing?
That's where.
We want to know that there's gonna be family size apartments here, right? But so if the plan is X, Y, or Z, but it's all studios, ones and twos, I think we look.
Yeah.
Because we'll be using the family center.
The plan is, the way it's been presented, it's supposed to be same size, right size or bigger, slightly bigger, especially when it comes to the ADA compliant apartments. They're gonna have to accommodate the wheelchairs and, you know, even the elevators as well and stairwells. So it's not gonna go smaller, but it's definitely gonna be bigger.
But-
Bigger or the same.
But the question is, are the large family size units gonna disappear in the name of sizing? Right sizing means I'm a single person living in a 4-bedroom. I get transferred to the 1, but then the family that's overcrowded, that should belong in the 4, goes to the 4. And I don't wanna see the 4 go away.
Right.
Oh, okay, I know that,
But that's never been
But
presented,
that's the
so.
question.
I know, but that's.
Many things have been presented here, Hector, that are the case.
Hector,
Yeah, identical to what you're getting.
Hector, I wanna say again, it's not just about you or someone else, the whole complex.
Yes.
At the end of the day, if there's 155 bedrooms, 4 bedrooms, are there 154 bedrooms being produced? And that's the thing that I've been put forth on a grid or information in the normal way that happens. I think we're getting to that now, just right.
As a point of clarity, I don't think ADA guarantees you the same size. It guarantees you.
It's not,
No.
Right. Yeah, accessibility. Right.
no,
That's what I'm clear.
he meant that certain rooms may change in size to meet accessibility requirements.
Okay, Pete, Roberta, and Raul.
Pete,
Yeah.
that's perfect.
Yeah. Anyone? Committee members? Not,
There's quite a lot of variables here. One of them is the family size, and that changes also based on your retirement. You know, you can have 2 people earning lots of it, have an affordable unit, and all of a sudden they're retired, and so now their income drops.
And their rent goes down 30% of their income.
Yeah, and it's also based on age too, because you know, as you age, you're not gonna be earning that much more.
But it's your rent is based on your income, no matter what. Whether
Yeah,
it's your
yeah.
age or your income.
On the overall, I guess that's not gonna affect the subsidy, because the subsidy is gonna always remain the same.
That's correct.
Travis?
Rural.
They've been very.
Oh, sorry. Oh, yeah.
No,
They're not all.
Committee first, sorry.
All right, so 2 comments. Following up to Rachel and Dolores' comments regarding the complexity, I get it. But you need that information in there. It's just a matter of a redesign of the Excel spreadsheet, condense it down to one
It's about-
tab to make it easier.
Digestible.
More digestible, but it's doable. You just need the right Excel person to do it. Do you have that? Okay, good.
Yeah.
Second comment. You've talked about how everything with inflation, all the costs have gone up,
Yes.
the interest rates have gone up. But also the market rates have gone up a lot.
And
So
therefore,
when-
the rents have gone up. meaning
The
the
subsidy will be higher.
And therefore, the income that the project owner will have is gonna be much higher, and therefore their ability to borrow more is gonna be there. So you have to show both sides,
Yeah,
that is the equation.
right? Okay, so it's not just the cost inflation, it's also the possibility.
I don't think the income's remaining at 30.
Yeah, no, it's gonna be much higher.
JD and then Travis?
No, Travis is hands down.
Oh, your hand is down? All right.
They all went down.
Basic, stupid question.
Yes, yeah.
Where are we? We're gonna have two new buildings for the moderate middle market.
No, that was the plan.
Oh, that was the old one.
That's the old one.
That,
Where we are
Right.
is the
Where are we
presentation
now?
that showed up at that meeting where rad people showed up and said,
Refresh.
we're gonna do something.
okay, JD,
Yeah,
this is the only plan the community board has supported.
gotcha.
The community board is considering and reviewing, are they different?
Okay, so we don't know yet what.
Well, part of it is, we have, as we go through this with the tenants and with
Yeah.
NYCHA and with related. To try to come up with something
So we have.
that is somewhere
Gotcha.
that resembles something that we've had consensus over. The problem is, what happened here is a consensus was achieved.
Right, gotcha. And 50% community, that's changed now.
That's also changed.
So that's another thing.
Anyone else
On the committee,
on the committee? And let's
but we
go.
have public members in the room and online who want to speak.
Let them know.
Yeah, sure. So, Mike?
Yeah, hi. Well, you've covered a lot of ground here and I appreciate it. I agree that we should get this into something that's condensed and relatable, something that folks can look at easily.
Unattended, Michael?
What's that? Excuse me?
You said relatable, and I said, is there a pun
Oh,
intended there, Mike?
yeah. Oh, very good one, Dolores. Very good, very good.
Mike,
So,
can you,
yeah,
make
so
it
look.
brief, please?
Yes, Mike, go ahead.
If you insist. Oh, look,
Thank
Joe, you mentioned the rent cap, right? So that's
The flat
gonna hit
rent,
me.
flat.
Yeah. I don't know where HUD stands on this, but I don't know if that policy still holds. I'm gonna find out about,
Mike,
yeah,
Mike, it's in the political agreement and our representative negotiated that, and we're gonna have to keep that in no matter what. That benefits, no matter what happens here, that's a key issue to keep people in the room.
yeah, okay. Well, let me just tell you all this, all right? You guys are fixing to lose an Elliott family here once my rent recert happens in a few weeks, all right? We can't spend thousands of dollars for this particular apartment anymore. Would you like to live in a 2-bedroom apartment for $5,000 in NYCHA? I don't think so. So I guess I'll just be a member of the board.
Okay?
Thank you.
Salinas.
Just
you're up
letting you
next.
know,
Thank you, Mike.
just letting you know.
Thank you, Mike. Salinas, you're
All
up
right.
next.
Hi. There's a reason Section 9 is underfunded. The funds for Section 8 comes from the same source as Section 9, which is Congress. The money is there. There's a reason Section 9 is underfunded. Congress is favoring and servicing the private companies. They are choosing
Yes.
to release the funds to private companies. They are being subsidized by Congress. The rent we pay, the tenants, now goes to the new managing company, which in our case would be Related and Essence. In public housing, our rent payment goes back to NYCHA. NYCHA has purposely been allowed to get run down. I do not trust Related. They have a history of not following through on their promises. They are not trustworthy and are in this merely for profits. NYCHA needs to be held accountable. There is a system in place. If NYCHA once ran smoothly 20, 30 years ago, it can run smoothly today. We need honest NYCHA employees to work in NYCHA, employees with principles. We are being sold out. It's obvious. The physical needs analysis had been calculated on false costs, the same cost that 70 NYCHA employees got arrested for. If NYCHA could afford to pay a vendor $4,250 to replace 6 light bulbs under fraudulent practices, then the money is available to fix the more serious problems in our apartments. The physical needs analysis could be revised with the correct cost estimation. We don't need $1 billion to revise our buildings. We could subtract fixtures that are not needed. Our windows are not falling apart. Our common grounds are well maintained. NYCHA could focus on the individual apartments that do need a new kitchen cabinet or a new toilet. The entire building does not need unnecessary upgrades. Focus on what's actually needed. As Dace claimed, a new plumbing system, a new boiler, and new elevators. This could drop the price to a more reasonable expense. NYCHA tenants are nowhere near the priority in this. We are in the way, and if they could, they would explode these buildings with us in it. I'm sure they've made these type of jokes behind closed doors. Chelsea has been long gone years ago. The treasure that once existed have slowly been dissipating. Let's hang on to the little bit we have left. Say no to private developers. They invade and they intrude. Public housing is a necessity in this overpriced city. They want to do away with it altogether. It's dangerous. NYCHA is keeping apartments empty. With so much homelessness and a long waiting list to get into NYCHA, keeping apartments empty just to please private developers. This is evil. We need to hold NYCHA accountable. There were only 6 tenants from Fulton and 6 tenants from Elliott Chelsea in the working group. Tenants were not involved in this decision making. There has been no outreach, no educating of the tenants regarding Section 8 versus Section 9. Outsiders cannot be making decisions for us. And then someone said that it's, someone said, I'm almost finishing. Someone said that it's difficult for tenants to understand. The tenants could understand when they are educated. We should make informed decisions, not go into this blindly. We should be educated on both sides, not influenced on the subject. It shouldn't be one-sided. I'm almost done. And we could be right side. Okay, we could be right side now. We don't need private companies to make that decision for us. It's common sense. And Mike Noble says he doesn't want to pay $5,000 to live in that apartment. Well, you know what? The NYCHA is not for a person like Mike Noble's. Public housing was made for the low income.
Please. Selena's, I'm asking you.
He doesn't want to live in NYCHA, then he should leave. It wasn't made for him.
Sorry.
And
really.
it wasn't made for Hector Vasquez either.
Not the issue. I'd like to the people in the room now. Thank you, Selena's, very much. Alexa.
Hi, good evening. I'm not too happy, with this board because, last night, as we got up from the board meeting last night, this man, Lowell Current, a member from you guys, came up to me and, Celine, and Celine, and told us that he wasn't gonna be, they weren't gonna be on our side because of Caesar, you know, and I find that discrimination against us because we've been attacked enough, with the tenant association, with the harassment on my Facebook, with threats on other people that have been fighting for Section 9 to save demolition. We've been going through so much. And this is enough that a board member would come up to me and tell me that, and tell me and Celine that. And what you said before, that there was nobody that couldn't comprehend, that's very offensive.
Okay.
Because
what did I say?
Hector, you cannot respond as a board member.
You misunderstood me. No, hold on. No, I want to make sure you understand. This is not about saying that
You
there
were
is a.
humiliated yesterday.
I'm gonna ask you not to address him anymore. Thank you. Now, Dolores, continue.
No, what I wanted to just explain is, I'm not saying that you could not understand, I'm saying we can't
You said
understand.
you, me.
We. I said
You said
we.
it in general. I understand.
I said we.
I speak English.
No,
And I understand when somebody's very condescending.
Okay,
To others.
I apologize if you took it
To
that way.
others.
I'm gonna apologize
I am
because,
I am tired.
let me,
I don't.
let me
trust the
apo-
board at all.
let me
You
apologize.
okay?
I'm apologizing for that misunderstanding, and I hope that going forward that you recognize that I was not meaning to be condescending in any sort of way. I don't understand a lot of what
And
was explained.
then they said, oh, he doesn't comprehend. You know, I'm an old woman and I know.
Okay, so, Renee, comments or questions?
Some of it I agree with Alexa on. The meaning that we have couldn't comprehend, and then saying the implication is public housing tenants couldn't,
No.
yes, we can.
Okay, so,
That, but I'm gonna say more.
sure.
The problem is the Chelsea NYCHA working group, everything is gone from it. So basically, you're starting anew. Nobody guaranteed from anyone that what was stated in that group would be done. There was no contract signed guaranteeing that. We have now started over. The Adams administration is here, Richard Godfrey's gone, Tony Simone is for destruction. Let's see, Eric Botcher, he doesn't even, he doesn't vet with norms, doesn't vet to set everything up. Last night, Wednesday, he had a meeting discussing with the environmental Julie T, saying what is the best materials to use for reconstruction. I can go to developers with that. We know he's setting us up for a demolition. Brad Hoyland can't say anything, Mark Levine can't even look at us. So that's part of the problem. We know that's what they want, and that's our destruction. We have whole floors empty in buildings, one person there. That can't continue. There
Can't hear. Can't hear.
Yeah, I think it's frozen. I don't know. It sounds like it's on their side. Anybody
Yeah,
hear me?
it's frozen. Give me one moment, see if I can figure out what's going on.
Okay.
I fully understand that. The politicians that you named off, I don't work for them. I don't report to them. That's not my job to report to them. In fact, I view it like you do, they work for us. So to be plain and clear about that, at the beginning. I'm sorry that you had that bad interaction with
Can
the
you
board
hear
member.
Online.
But that doesn't, but they don't speak for everyone at this table. and
We
it's
missed a
not-
lot.
So the statements about it being hard to process, understand, was about us here.
Yeah. Us here.
Particularly, she read off my credentials and I was struggling to process it. That's why I was asking all the questions I asked. And so there's people in this conversation at this board right now that have not made a decision whatsoever. In fact, speaking for myself, if you notice, every question I've made has been about what's the impact on the residents? And I'm going to continue to ask those questions. I have familiarity with Related as far as I know how they process things. The owner is the biggest booster in my alma mater. I know his business practices. I don't fully trust those. So that's why I ask the appropriate questions every single time. So when this board goes through the process of analyzing things and trying to catch up, and we ask Joe the questions about what NYCHA is supposed to do, we're trying to play catch up and we're trying to make the best decision possible for all people here. That's plain and simple what we're trying to do, and this is part of the process. I know it takes a long time. I deal with long processes at my current job too. People get frustrated about the long processes, but ultimately the process makes sure that everything gets done correctly, because we know bureaucracies, it usually takes a long time to get it done right. And if you don't cross the i's and dot the t's, they will mess it up or someone lines their pocket somewhere. So please believe, I know you're frustrated with this process, but we're trying to do the right thing right here. That's
It's
it.
not the frustration with the process, it's the inability of people to know that they're lying through their teeth. If the place is demolished, we're just something they have to put up with. You really don't think they're gonna give us quality? They will not.
Renee, if you note, this board in the discussion has been trying to get information. And one of the things we find was the idea, a decision was made to segregate all the NYCHA apartments and tenants into a few buildings.
Right.
In the letter we wrote last night, we said, we do not support that.
I read the draft scope of work.
Exactly.
That you did.
Right, and the point is, and I know you did, and the point is that it has been unique in a public process, that the community board has not gotten detailed, full information all along the way. There has been an ongoing process, I will say by NYCHA, to hold back on information.
Well, now you know how we feel.
No, we felt it. And all we've been doing is being a can opener to get the information.
I've been doing the work with too, Joe.
And this committee has also been doing that various parts of the city, continuously over the last 2-3 years, and getting information filtered to us last second.
Right.
So we fully understand your frustration. So this is not the first time we've had to deal with this process in that way and the slow cycle of information, and it won't be the last time.
And a key issue that we're waiting for here is how many vacant apartments in which buildings. Okay, and I'll tell you, I don't find it surprising that information, which of course the owner operator has not turned over earlier, because there's a reason they're not turning it over. They don't want that to be public. It's gonna eventually be public. And our elected officials, I don't work for them either. We're trying to bring them along in this process to have critical information so they can make a decision based upon fact, not just conjecture, not just a messaging campaign. And that's what we've been in since July of last year.
So I want to take a step back. I mean, Renee, you know this, the community boards were advisory only.
Yes.
And we're only as strong as the voices that actually participate. And all of you have been in the conversation all along the way, and that's what we're trying to incorporate with the communication that we provide to the agencies, to the electeds, et cetera. I think what's changed from before 2017 to now is that there are other, we'll call it players, other forces, other things that aren't as aligned with hearing from the advisory part. Which means that we can only be strong if we have more voices participate.
Right.
I don't think that we are as strong as a body to influence our electeds the way we were, let's say, in 2014, 2015. It's unfortunate, but if more of folks that are concerned, that do have these questions, continue to participate, that allows us to incorporate more of that voice in there and to try to put more pressure to say, as an advisory, this is what we're hearing. This is what we're hearing.
Also, if somebody on the board spoke to you that way, they were out of line,
Yeah.
totally out of line. And I think we can apologize for a board member who did that. Totally wrong. And we should apologize for you. You shouldn't have done that.
Thank you.
He was out of line.
And we all jointly have tried to cope and manage the outbursts from Caesar, because it's been disruptive to the public process. I have talked to him personally.
They have said that
Why?
Ronnie has influence on him. He does things on his own.
We know.
No, and we know that, and we have all had conversations that he is not representative of the tenants of Chelsea Fulton, period.
Yeah.
He's not.
He's representing himself.
And he needs the direction, he's just not. The problem is, he acts out in a way that stops the public discussion, and that's the hard part. At the meeting we had on the prior meeting at Chelsea Land Use, because of that, having to stop, people could not speak.
You know what the problem is? The low income people that will be left out when they start charging medium rent in 20 years because these are contracts that they're offering.
I'm gonna again correct you to say that there's an underlying agreement to keep it at 30%.
Yeah.
Irrespective of the contract. No, a deed restriction on the land that forces related to go get the section. No,
It's not
You
them.
know what the
It's
landscape,
not related.
you know what the collateral is? The landscape of NYCHA. They're gonna take over.
I think, again, and I want to say the following, having led this particular subcommittee on the most complex thing, I didn't find any of the NYCHA tenants not understanding. I found that we all struggled through this side by side to understand it. And Dolores's point, clearer, simpler, direct. And there were people who started out 100% against this at all. And those are people who going through the process understood you have to take certain actions to get somewhere. If in fact, your current goal is to stay with section 9, as Selena said, is not funded by the Congress of the United
Well,
States.
there were 70 employees that told them.
Doesn't matter, across the nation, across the nation, it is not funded. So therefore, let's go with a solution to work for this neighborhood, that's all. I want to say thank you all for sitting, through this and really trying to get through a complex thing that sets us up for the future.
Money. Thank you.
Oh, yes, that's actually good for us. Thank you all very much.
No, we don't.
No.
No, we don't.
Usually.
No, we don't. That's not.
Thanks for Wilson, can you still hear us, or did we lose? Yeah, okay, so we're done. Yeah, bye.
All right, thanks everyone. Bye. I'm okay to